Hi all, it's 4:30. Let's start the session. Thank you for all joining, especially thank you Officer Kayla Carney and Dr. Pavan Pamadurti, psychiatrist. So today we have the session like impact of drugs on teens and adults, right? So we know everyone, a lot of students involving these days in universities in drug trafficking, and our police officer from Frisco, Kayla Carney, came forward like to give the session, and also Dr. Pavan Pamadurti, our BOT co-chair, came forward to have this web session. Thank you both of you, and thank you for the community to join this session, because it's very important. Like all of our kids are going to schools and colleges, like where they see a lot of like drug issues. It's you cannot like our kids cannot avoid those things. We should know what are the impacts on our kids and on us as well. So many of us, we don't know the rules and regulations here. This session is going to give like what kind of like rules and regulations and impacts on these drug issues. Thank you one and all. And officer, please go out and explain. I have like a few questions to ask you. Once you're done, I'll ask the questions to you and also Dr. Pavan Pamadurti as well. And if community has any questions, like please ping me in the chat and post your questions here, or you can raise your hand, and so that I can allow you to ask the questions as well.
Krishna, sorry to interrupt, but once the officer completes her part, I have some presentation. So I believe in what if the community can visualize what I'm showing, I think that will go into the memory rather than having random questions.
Sure, doctor.
Thank
you. Yeah, thank you. Officer, please go ahead now.
Yeah. So guys, first and foremost, thank you for being a part of this conversation here, especially with our teens and our youth. Unfortunately, drugs and narcotic use is a pretty big pandemic within the teen population, and I'm not just speaking with Frisco. Just so I can kind of get a good picture of who all that I'm talking to. Is this primarily Frisco residents?
Pretty much DFW.
Pretty much DFW, and also we share all over. I mean, in social media all over the US. Maybe people are from other states as well, ma'am.
Okay, very good. So I'm much more of an open communicator. So if you guys do have any questions, just type them up in the message or filter it through the gentleman up here, and we'll go from there. But to give you a little bit of my background here, I've been with the Frisco Police Department since March of 2016. I've worked in assignments in patrol, both night shift and day shift. If you know anything about policing, there's a vast difference between the crime that occurs during the daytime and that occur in the evening times. I've been a part of our bag patrol unit, and I'm currently assigned to our community services unit, which is the unit that goes out and does educational presentations for things like that. I grew up in Allen, Texas. I graduated from Allen High School a while back. I got a baby face, but trust me, I'm older than what I look. I went to Texas A&M University. That's where I graduated from. So that's great. So if you're a Longhorn, I'm going to ask you to kindly leave this Zoom meeting here. It's I don't know if you'll be able to understand. I'm just kidding. I commissioned into the United States Army from Texas A&M as part of the Corps Cadets there. I was an engineer officer, and then served my time in the Army National Guard component. And then I'm where I am today. When I was on patrol, I took a personal interest in narcotics. That was kind of my thing in my specific area that I was most knowledgeable about. And specifically when it comes to teens. Can anybody tell me, just in the messages here, which type of narcotic, and when I say narcotic, I'm talking about any type of drugs that y'all are aware of, what narcotic is the most popular right now?
Cocaine.
Cannabis.
So the big one right now that everybody's talking about is marijuana, right? because in some states it's legal, some states that it's not legal. I'm not going to go into the medical stuff of that because I am by no means a professional on that. That's why we have the doctors on here. They're much more educated on that than I am. But it is still illegal here in the state of Texas, and that is something that's pretty rampant through our high schools as well. And something to look for as parents or educators is that, so you have the leaf form of marijuana. We were tracking on what that looks like. It's like it's a green bud. It's a leafy substance. What they do is they take the buds off of that marijuana. They roll it up into some type of cigarette type paper, roll it up and smoke it just like a cigarette. Okay. You could tell the difference between that and a cigarette very easily just by the odor. The odor of marijuana is very distinct and it's very different than what a cigarette looks like. But something that we do have a bigger issue with is the use of THC, which THC is the derivative of marijuana. Okay. And there's extracts of THC and THC oil that you can use. So you can make that in brownies. You can put that oil in electronic cigarettes. So like the e-vapes that you see going around, where they're supposed to have nicotine flavors and stuff inside of it, they will put that THC oil inside of there. And what the issue is with that on the legal side of things is that is technically a felony offense. Okay. And a lot of people do not know that. When I was on patrol, I can't tell you how many people did not realize that were in possession of that, and now they have a felony charge on them. So as it affects for teens, this is such an instrumental part. This time in their life, being a teenager in high school is so important right now for gaining, just maturing as young adults and making good decisions, but also for applying for colleges for their future. How is a felony offense going to look on a college application? Probably not pretty well. I'm not a college admissions counselor, but I would assume that that's not going to look well. Even if it's just a leaf form, and that's a Class B or Class A misdemeanor, depending on how much you got. Probably not going to look very good with that. So taking that all into considerations, things to look for as far as marijuana usage within teens is them being more lethargic. That is the reason why people typically smoke marijuana or do it in other forms, is for the high is really to mellow them out, is the effect for that. And that's what they're looking for, to calm them down. So Colorado, it's legal up there. I don't know if it's completely legal or if it's by prescription or whatever it may be, but either there or Oklahoma, what I do see is people will go up there on vacations or road trips and they'll purchase it from there, marijuana or the oil and whatever assortments of gummy bears that they have and everything there. And then they'll bring it back down to Texas. The issue with that is then you are transporting narcotics through state lines, which is a federal offense. So that's really not good. So Oklahoma is just a good 45-minute drive, and right upside there, I used to go to Fort Sill, Oklahoma all the time for Army stuff. It is everywhere up there. It's super easy to get and then come down here. So you got the implications of what it does to your body and on that high that they have, but then again on the legal side of things. Also, opioid pandemic. That's a pretty big thing as well. Xanax, it's called Xanny. So there's pills and they have like little squares on them, and it says Xanax on them for the most part. That's passed around in schools. Adderall is also passed around in schools as well. The thing with that is, with Adderall, it is typically people take that to maintain concentration if they have a lot of exams coming up. So you gotta love them because they want to stay up and study and perform at the highest levels. But then that's a controlled substance as well. If you have any type of prescription medication that You do not carry in a prescription bottle. You must carry a prescription in a prescription bottle that is labeled to you. That is a criminal offense. So not that we would ever do this, but even if you go pick up, mom's nausea medication, okay, and you take it out of the bottle, put it in a little baggie, and then put it inside your purse or your wallet, it's not your prescription, and it is a prescription. That isn't a criminal offense. So that is a good thing to make sure your kids are aware of that. Or one thing that I wanted to mention specifically is our school resource officers. They are a great and fantastic resource if you have any questions regarding to your teen's behavior and whether it's legal or illegal or kind of what's going on in those specific schools. I think we have 12 high schools right now in the city of Frisco. So every single high school has a school resource officer. So reaching out to them, they will know the current trends in those specific schools. So, marijuana, Xanax, the Adderalls, and things like that. And they also have more resources for programs that your children can get into to help get them away from that type of environment. A lot of times kids these days, social media, right? Social media is a big thing. And you see I have a personal Instagram account. I have the police department's Instagram account here. If you take a quick scroll through there, you'll see celebrities in what people call Instagram influencers, right, on there. And they're on there using marijuana and all these other types of things. And that's who your kids are getting things from right now, is what they're seeing. They see that as what's the cool trend. And unfortunately, when you are a teen, despite being in a good home with a good family and good principles and morals, sometimes you do give in to that peer pressure. And that's why I always, when I dealt with a teen, even if it was for, if it was for a very small amount of marijuana, I always contacted the parents, because I think that's a good place to go. Because the parents do need to be aware of those types of situations there, so they can address that at home on a more personal note. Does anybody have any questions as far as specific things that are going on within the city of Frisco? Maybe not even just the high schools, but anything at all.
Where do they normally buy these drugs? Kids, let's say they're teenagers, youth. Where do they buy these drugs? What are the outlets?
Other people. So Snapchat is a really big thing too. So they'll meet people randomly through these social media platforms, Instagram, but I do see Snapchat a lot, because the thing with Snapchat is you can send a message, you can read it, and then it deletes. Unless you get a warrant for that Snapchat thread, then we as police can look into that. But Snapchat is a very, very big thing. So you have Snapchat user Big Daddy 1234 promotes himself as selling THC gummies. So one kid gets that information, buys it off of him, then sends their friend that got Big Daddy's username, and they reach out to him, and then turns into a big web. He may not even live in Frisco. He may not even be a Frisco resident or high school student. He may be from Carrollton, but that's the power of social media right now.
So that it's not like gas stations, right? I mean, I used to think about gas stations would be good outlets for drugs. So that's not really the case here then.
No, there's not a specific trend that I see with gas stations. I mean, any place could really be a place where drugs are going to be sold and exchanged between two people. It's easier done than what people may think. So I see that sometimes we keep medication in a small pill box when traveling. Is that illegal? If it's a prescription, I always tell people I would take the bottles with you just to be careful. I can't speak on what Oklahoma or Louisiana, what their laws are. I can only speak on what state of Texas is.
Officer, I have a question regarding, you see a lot of shops here that are opening up CBD, which is different from the THC.
Mm-hmm.
And the state laws are also different. Is there anything about a specific state law about the CBD?
On CBD, no, I think it's under 0.03% THC.
Yes.
So CBD has the small amount of THC in that, but state legislation is under 0.03% THC, then that's what's legal. I don't use it because obviously I'm in a police capacity and I'm not going to, ingest that and take my risk. But you do see that at like gas stations and stuff like CBD lotions, or you go into CVS, they even have stuff like that inside there. And there's also shops here in Frisco that are selling these the CBD products. Our department is aware of those places, and then our specific unit that handles narcotics and everything work with code enforcement to ensure everything's kosher there.
Okay, thank you.
Mm-hmm. Anybody else have any other questions?
Officer, yeah, some people sent me the questions. I can read out. Maybe can answer for them. What kind of legal issues could a teenager face if they were caught in possession of or distributing drugs?
Possession or distributing drugs is a different thing. So I saw the link that you had said, or the article that was sent out about the trafficking. So the distribution of drugs is a very different charge than being in possession, right? So how it works is that the possession offense is broken down by type of narcotics. So marijuana from like cocaine and meth are all very different substances, right? So that's how that's broken down. And then it's broken down even further by the weight of the narcotic. Okay. So, so like possession of marijuana under 2 ounces, and then it goes to like 2 to 4 pounds, and then higher from that. Cocaine and meth, so the more serious, all narcotics are serious, but the more hardcore drugs like cocaine and meth, they are measured in grams. So again, being in possession and then distributing is 2 very different charges. Distributing would be the sale of drugs. If you are in possession of an abundance of drugs and narcotics with the intent to distribute and sell and profit off of that, that is a separate charge.
Okay. Thank you, Doctor. And other question, Vishwa Kandi asked, how can the parents identify if the kids are using drugs?
How can parents what?
How can the parents identify if the kids are using drugs?
So it's a change in your normal behavior. So it's kind of a weird balance. I have 4 younger brothers. So as I grew up, I kind of figured out there's this thing called hormones when you're a teenager, right? So they are naturally growing and maturing, and sometimes their emotional stability is a little bit off because they're getting adjusted to all the hormones that are going into their body or developing. But anything that I would say that is a normal is a change of behavior, a significant change of behavior. So if your kid is like a super active type person, constantly wants to go out with friends, or engages with the family a lot, but then that changes to where they're just real lazy and lethargic, and if they're high on it, they're going to have kind of glassy eyes, like on marijuana. They're going to have glassy eyes, red eyes. You'll be able to tell. And again, if somebody has just like smoked marijuana, you're going to be able to smell it on them. It's a very strong odor, and it's a very distinct odor.
Yeah, thank you, ma'am. And other question is, how and where are drug dealers and our teenagers finding access to these drugs? And what preventive measures should we as parents take to ensure our kids don't become involved with the drugs?
Right. So let me just confirm that we're asking where where are they buying it from, and then how can you prevent that? Is that in summary what the question is? Okay. So again, social media is I would say probably the biggest platform there. When I was on patrol, and again, I can speak to myself as a single officer, this is my own practices that I did. If I found somebody to be in possession of something, I would try to get information from who their Snapchat dealer is, because that is the biggest thing. Right now, social media is the way that kids keep connected. So if you are a parent that watches social media, the Snapchat is the one that I would definitely take a look at, see who their friends are and who they've recently been Snapchatting. The ways to prevent it as a parent is really to have those hard discussions with your kids. about them and the consequences of that, of having them. I've noticed that parents that are more active in their kids' life and not necessarily being like overbearing, but being able to have that line of communication with your kids where they feel comfortable having those conversations with you and you having those conversations with them, that really clarifies a lot of things. And it also builds a better relationship between the two of you.
Okay. Yeah, ma'am. Maybe these are like related. So what are the main narcotics that are being circulated in schools or colleges during these days?
Yeah, again, so that's going to be marijuana, so both the leaf form and THC, Xanax, and Adderall. Yeah, Adderall for the obvious reasons for kids, especially in colleges. Even when I didn't associate with anybody that took Adderall illegally when I was in college, but I did know kids that did that, and that was during finals times, especially if they're in like honors classes. They really want to be able to stay up and really use their time as effectively as possible.
Okay, ma'am. The other question is, how much money or community service would be required to bail out a teenager or adult out of a drug-related offenses?
So bailout. So the bail is going to be set by the judge. So if they are taken into custody by Frisco, okay, we take them back to our 5-star resort, Frisco jail. So they go there, they see a judge whenever they come in the morning. So if they're arrested at like midnight or 2 a.m., they would stay there until they see the judge at 8 a.m. whenever he comes into town, or whenever he comes into the jail. He will look over the report. He will set the bond, and the bond varies based off of what the offense is. So that marijuana possession and possession of methamphetamine are going to be two very different bonds, because they're different levels of an offense. So if I was you, a parent, if your kid was in a position where they were taken into custody, I would just have them make sure to notify you what that bond amount's going to be. But it's going to be a significant amount. It's not going to be anything, light to look at.
Okay, ma'am. Thank you. And the other question is, how do drugs affect an adult's ability to apply for jobs and other academic opportunities?
Right. So typically, some for jobs do require a background check. So if you're convicted of a crime, okay, so if you're arrested and you go through the trial process and then you're found that you're convicted of said crime, that's going to go on your record until it's expunged. And a lot of jobs, they do require that background check, so that would show up. So that's going to create a significant issue there. And as far as colleges go, I don't know if they do the background check. I would assume that they do background checks with college these days, but that would be something also, the consequences of that.
Yeah, thank you, ma'am. I think pretty much you covered, and there are one question from the chart. What are the normally used doctor prescribed drugs that can be confused or misunderstood as narcotic drugs?
Yeah, so as the doctor said, ADHD medications, pain medications. So if you're traveling and you have like your nausea medication or whatever, like in a bag, and it gets crushed up and it looks like a white powdery substance, we're not going to automatically say, oh, this is cocaine, and they take you to jail. We have testing systems that we go through. So if we suspect something of cocaine, then we have these test kits that we take out there and we test, and we get a presumptive positive test for cocaine. Then you'll likely be taken into custody for that. But that's because that is an actual test kit that gives you a presumptive positive test that says, yes, this is cocaine. If you have that crushed up, ADHD medication or pain medication that's prescribed to you in there, and it doesn't test positive for cocaine, and we're saying that that's going to be cocaine, we're not going to take you to jail for that.
Yeah.
It's best just to leave everything in the sealed prescription bottle with your name on it.
Yeah. Thank you, officer. Thank you very much. I know like this is holidays time. I requested like chief. He said that it's not possible this year, but you all made it. Thank you for all your help. So we appreciate like your service for the community through our Telugu Association of North Texas. Thank you once again. I wish you happy holidays and happy new year as well.
Awesome. Thank you.
Yeah, thank you. Now, Dr. Pavan Pamdurti, I welcome you to talk about the impacts of drugs on teens and kids, like especially psychological issues.
Before I did the officer leave, Krishna?
No, I think he's there.
Officer, before you leave, we talked about teens, focus on the cannabis, THC and marijuana, those products, but there are a lot of adults also in the group. Can you please, briefly tell us, as an officer, what you are going to look into before you charge an adult for DWI or public intoxication?
Okay.
Because the topic is alcohol, so I just want that from legal side.
That's very good. So for DWI, so there's a certain process that we go through that. So DWIs are probably one of the most extensive things that we do as a police officers, DWI arrests. From the initial traffic violation all the way to trial. So when we look for that, we look for, abnormal, if they're driving. So driving while intoxication is if you're intoxicated by the voluntary consumption of alcohol or narcotics in your system above the legal amount. Okay. Public intoxication is being intoxicated to the point that you're a danger to yourself or others in a public place. So DWI is when you're driving and you're drunk, and PI is being drunk to the point that you're going to be a fool out in public, but you're not behind the wheel of something. So backtrack to DWI. So we look for abnormal traffic violations, right? So if you're swerving all over the place, you're bumping on the curb, something somebody typically wouldn't be doing outside of just the normal, I didn't use my signal to turn. Would then initiate the traffic stop if there's probable cause or reasonable suspicion to believe that they're intoxicated or there's a criminal offense that's being conducted. When we go up there, from my experience too, most of the time if they're intoxicated, as soon as they roll down that window, you're going to be able to smell that odor of alcohol on them because it's coming out of their pores. It's going to be when they're talking to you, you're going to be able to smell that alcohol. They're going to have slurred speech, red and glass eyes. Their dexterity, something that I look for is when they're, trying to get their driver's license out of their wallet. What is their dexterity like? So are they having trouble just using, fine motor skills? People have given me gift cards for their driver's license before. And they've done that. I've asked them to, I need your driver's license. They give me another gift card. Okay, that's not really normal behavior for somebody. So at that point, if we believe that they are intoxicated, then we would do what's called their standardized field sobriety test. And so that is what everybody knows is the walk the line and, the eye test and everything like that. There's a series of tests that you go through. There's indicators that would point to that. To a level of intoxication. Through that, I'm not going to get into the weeds with all of that stuff. It's a very lengthy process there. But if we believe that they are intoxicated by the introduction of alcohol or a narcotic and are above the legal amount, then they are taken into custody. The car likely will get towed, or they'll be placed in a public parking spot with the permission of whoever it is that we're taking into custody. Once we do that, we go back to the jail. We read them their rights and everything else with that. Typically, you're either going to get a breath or you're going to be requested either a breath or a blood sample. Most of the time, it's going to be a blood sample. So you read them the rights. If you consent to a blood sample or breath sample, then you get to keep your license until your hearing. If you don't, then it's taken away and you have to be given a temporary driver's license and then go through the ALR process. For the blood draw, we'll take you to likely like Medical City of Frisco or one of the local hospitals there, and one of the nurses will, or let me backtrack. If you do not consent to that, we get a warrant of the entire incident. We send it to a judge. The judge reviews it. If he's like, okay, this is all good, he'll sign off on that. We have the warrant in hand. Then we'll take them to the hospital to get the blood drawn by a registered nurse, bring them back to the police department, and they'll see the judge in the morning. Public intoxication, that's going to be people who are, like I had said previously, intoxicated to the point that they're a danger to themselves or others in a public place. So if you come out of the bar, you got keys in your hand and you're trying to get inside your vehicle, but you're not about to drive, you're still just in a public place, and you're dead set on driving, we're going to take you into custody for public intoxication because we don't want you to get in that vehicle and possibly harm somebody. Or you're fighting in public because, you know, you're intoxicated. There's a variety of things. Public intoxication is a Class C misdemeanor.
Thank you, officer.
Thank you so much for your service again, and thank you for your time for today. Thank you so much.
Of course.
All right. So Krishna, shall we move on?
Yeah, please. Yeah, go ahead, doctor. You can.
I'll try to share my screen here and see.
1 minute. Let me allow you to share the screen.
Thank you.
Yeah, now you're good. You can share the screen, doctor.
Okay, one second. So I just made the slides so that, you know, I have a good memory also, and, you know, I know what I'm, you know, telling you also, that you also can make some notes, you know, to teach your friends and family members, and also to talk to your kids about it. I know there will be a lot of questions, but I know the type of questions because I also come from the same background. So I'll try to touch most of the points here. I want to take the alcohol first because I do still get, you know, a lot of, you know, clients from our community that have been arrested or that have been struggling, and, you know, family members are concerned with their, you know, amount of alcohol behavior. And the officer has, you know, already educated us about, you know, the laws about what happens if you're caught with, you know, driving under the influence or public intoxication. So myself, I'm a psychiatrist. I've been practicing for 6 years, including training close to 10 years. Primarily, I treat all kinds of behavioral problems and brain illnesses from age 13 to you know, geriatric population and old age population. I have no affiliations with any pharmaceutical industry or any research trials or drug companies, no affiliations with cannabis industry. I'm an honorable member of Neuroscience Education Society of United States. Currently, the voluntary organization, Tantex, I'm the co-chair of Board of Trustees. The main objective of this, when Krishna asked me for this, is I've been planning to do this for a long time after seeing a lot of family members struggle with their kids and a lot of, you know, spouses struggle with their, you know, husbands for, you know, alcohol. I've not yet seen a male coming into my office and, you know, asking for help for his wife alcohol problem yet. I hope I don't see that in the future also. But, you know, type of substances that the office has already talked some of them, but I will tell a little bit more focused on alcohol and marijuana. And in the future, you know, I can do one more session for the community about the other drugs. We have to really understand the difference between what's marijuana and what is CBD that you see all over the signs everywhere, and how, especially marijuana, how it can affect the kids, and what exactly has been, you know, the research and studies, and what you can use it for and what you cannot use it for. We'll go into that details. I'm not going to go too much into details about, you know, opiates, which are pain medication that are also abused to get high. Methamphetamines, as the officer said, it's mostly used for focus, but if you make a correct molecule, you can use it for ADHD, which is commonly seen in adults and also in children. Cocaine is, you know, one of the most dangerous drugs that I've seen. I've seen people die in minutes because the heart rate goes pretty fast. So your blood pressure can go up to 200 and above, and they get brain hemorrhage and brain starts bleeding and they immediately die from it. So the last three, I would highly encourage, any of the parents or the kids, talk to your kids that these are the most dangerous narcotics that you should completely stay away from it. But there is a question always that, okay, opiates like hydrocodone, if you go for a dental appointment, you go for a knee surgery, a sports injury, you will be prescribed hydrocodone, but if it's prescribed by the doctor, just take, whatever days he's prescribing. The laws are different. You can't get more than 7-8 days now for small surgery. If it's a major surgery, you might get it an extended prescription. So you have to pay attention to why you are using it for. I would not recommend any methamphetamine or cocaine until unless, doctor prescribed, amphetamine molecule is prescribed for kids ADHD. And as the officer said, always carry the bottle if you're traveling with your kids so that you know that it is a prescription one. Do not open the bottle and leave like 5 medications because you're going to Colorado for 5 days, because you cannot be able to confirm that it was a prescription molecule. These are some of the terms that I will be using it, but one thing that we have to always understand with all these drugs is over the time we build tolerance. If you see yourself, you have a lot of friends. I can ask Krishna, if he has seen. Krishna, how many of your friends who started with one drink in their life are they still drinking one drink after 20 years?
I can say 0, I think.
So that's what is called tolerance. So we build tolerance to the alcohol. So we start with 1, then we gradually progress to 3, 5, 6, 7. So that's what we need to also monitor ourselves if you're using it for recreational reason. So once you build a tolerance, that's when you go to the addiction. Abuse and misuse are 2 things that you initially start, that I'm abusing alcohol once in a while, but that slowly is the warning sign that you are going towards addiction. In between abuse and addiction is what the tolerance is, the piece that comes in between. So how brain adapts to these substances are, the brain chemicals are very weird. No human naked eye can see those until unless you have a specialized scan that you can put your brain, that you take alcohol. There is a brain chemical that gets suppressed. Over the time, brain says, oh, I'm having good time, so keep drinking, keep drinking. After 10 years, you started with 1, even 10 alcohol drinks, does not do anything for you. So you want more, you want more. So that's how the addiction process works. But a lot of, my friends and, my clients ask me, what is, appropriate? How much is limit? What is my limit should be? So you always have to think a standard drink. A standard drink has 14 grams of alcohol. So if you go to a restaurant and you ask for a bottle of wine for 5 people, you are getting 5 standard drinks. A can of beer is 1 standard drink. A shot of hard liquor is 1 standard drink. So, but this standard does not apply to the alcohol that's served in restaurants and bars. Sometimes, when they're busy, they're putting it a little bit more, or when you are with a friend who is very friendly, he might be adding or sneaking a little bit more. So we have to keep that in mind when I say the standard drink. But you also have to keep in mind, the age, your liver is not able to process the amount of alcohol at the rate that is required as we grow in our life. Male to female, because female body is very thin, or thin people with less fat content, they tend to get the alcohol directly released to the blood, and that's when they get toxic pretty fast. So that's why I put their body mass is one of the major factor. I'm not saying that, people that are obese or fat, can take too much of alcohol, but they will still have the effects, but it will take for some time, like few more hours compared to a thin person to have the, acute effects of alcohol. So going back to what is the standard based on the National Institute of Alcohol Abuse and Alcoholism, they say that average, in men, 4 drinks in one day. I'm not saying that you all should go back and start drinking 4 drinks today, but that's what average, in this population, in this country, what they think is 4 drinks per day. In women, 3 drinks in a given day. So you are averaging around 14 drinks. I don't think there are many people that even average 14 drinks a week, but if there are somebody, you're still in the, the limit as per the health, but you have to keep in mind what hypertension, diabetes, liver problems you have, and you need to monitor and cut down that. If anybody is going beyond that, it is becoming harmful. When do you really call a person who is really dependent? Is somebody that's drinking between 6 to 10 drinks per day, pretty much every day. And he cannot, we might have seen back home or here that, when the shops open, I used to see as growing up, there were people lined up at 6 o'clock trying to drink. So I call those people as somebody that is dependent, that they cannot survive without having that. Their brain is asking that, time, this is the time I need to go there and have it. You call them chronically dependent if there's somebody drinking more than 10. And I've seen a lot of, people that try to do that. And these are some things that, really, for our population, family disharmony and violence is one of the major things, how alcohol is affecting. And, in kids and, young adults, the reduced school and work performance. As the officer said, accidents and injuries are the other ones. And the main thing that I've seen, the youngest patient I've seen in my life who have been dependent on alcohol for more than, 20 years, beginning his 20 years of his life, drinking like 6 to 10 drinks. He developed, memory problems very early in life, and, he finally lost, everything. And so, we might think that, okay, it might not do anything other than to my liver. But I want to say, even though it's not on the slide, alcohol can affect every organ of the body, including skin to eyes to brain, whatever you want to take, pancreas, reproductive organs and everything like that. So you have to be very careful with the amount of alcohol you drink. So the officer talked about the legal limit. So we are getting into what happens, how many standard drinks I can be. So if you look at this to the left side of the slide, anybody that is in that 1 to 3 standard drinks, they can be very normal behavior. I'm not saying you can do 1 to 3 drinks and drive. We all need to use our own judgment for that. But anybody that is going beyond, like between 3 to 5, 5 to 9 standard drinks, you are getting close to the legal limit, which is 0.08. And if you look at the other side, that is when you start being more talkative, you're losing focus, you are wobbling, you cannot walk straight, you're slurring your speech, you're not getting your words out. But the good thing about our community is most of them, socialize and they drink in group. So everybody is watching for, other person, and they don't let that person drive. So that's another important thing. I'm not saying that you can drink because you are around a lot of people, but don't drink by yourself and drive, because there is nobody else to watch you. Somebody can stop you from getting in the car, if they see you that you are not ready to go home by yourself. So the legal limit can be reached, you're going above the legal limit when you are crossing that 3rd or 4th drink. Plus, you have to also keep in mind those factors, like if you have diabetes, you have a liver problem, then you are going into dehydration. Mostly in the summertime, we are not hydrating ourselves. You can get intoxicated pretty fast. So you have to keep that in mind also. What are some of the factors why some people drink more, why some people don't drink at all, why some people limit their drinks? There are a lot of factors. Some people use it just for socialization. That's what I feel like in our culture, that most of them are using. Some of them are using it as a stress management because they work so hard. They go home, they want to have 1 drink, but the one today might be 10 drinks after 7 months. Especially kids, if they're seeing you drinking every day in the house, and they see that after you drink you talk more, they pick up that kind of behavior from you, thinking that, oh, my dad used to do that, he was more social when he was drinking, so I think I should also do it so that I don't be very timid. And when do kids pick up alcohol in their life is if you're not really supervising them, you're not talking to them about their stress, you're not paying attention to what kind of group of friends they are being around. As the officer said, that they were very friendly with everyone, they were very active in sports. All of a sudden they're losing interest in everything. This applies globally to every drug. It's not just the alcohol, but we have to keep in mind, if they're losing interest in whatever hobbies they had, you have to start questioning yourself. Is there something that I'm missing? And have a friendly conversation about, is there anything that's missing? Is there anything you all can do to help the kid or the teen or your children? So the peer pressure is the other one, and that happens to adults also, and also the children and teenagers, is that they're drinking and they get to force them, okay, it's okay, have one drink. And then what if they have a small anxiety problem and they feel a lot better because alcohol can work as a medication for anxiety, and they say, okay, this is easily available, so let me go and get a little bit more alcohol and start drinking for treating my anxiety. So, and then it also runs in culture, depending on where we come from. So there are social factors, family factors, and it runs in genetics also. If there are a lot of family members who have been addicted to alcohol, you can also see that run into the pass on to the children. And there are some of the psychiatric illness like depression and anxiety, ADHD also sometimes being used. So the main thing is we all need to help ourselves, encourage somebody, your friends or family members that have problems, refer them to treatment. You don't need to be shy about it and be timid. It's a disease like diabetes and hypertension or blood pressure problem. How you go to a doctor, you go and talk to them and get early treatment. Prevention is the goal. So talking to our kids early and preventing and making them understand that alcohol is for this particular reason, this is what the expectations are, and talking to them about it can help to have a better future for them about it. So that's basically about alcohol. But the real problem that we are facing right now is the cannabis. And why I say that it is a real problem is that especially, a lot of us have children. Some of them are in their high school, some of them are in their middle school. We need to. Krishna, are you able to see my screen?
No, doctor.
Okay, let me see 1 second. All right, that should be here.
Presentation is now it's coming. Yeah.
Now it's coming.
Yeah, thank you. So, there some of the slides here will be very confusing, but bear with me. I'll try to explain in the terminology that every audience in this group can understand it. So I want to differentiate. Cannabis is a global term that is used for two different things. Anybody here, if they have kids that have already used it or they want to use it, after this presentation, they need to really seriously think about the harmful effects of this substance, especially more worse than alcohol. We all have in the body cannabinoids. There has been a lot of research about it. So the goal about learning cannabis today in the next 15 minutes is how it can affect us. What are the long-term consequences of heavy cannabis use, which when I say cannabis, you can also use the word marijuana. Educating ourselves, regarding the potential risks of, continued use of it, and how is CBD different from marijuana. So we'll get into that. Is CBD same as marijuana? No, it is not. Why is that? Because a lot of us might have read about, there are two types of plant, as the officer explained, marijuana plant, and there is a hemp plant. Hemp, H-E-M-P, it's a sister plant of marijuana. So cannabis oil is, derived from that hemp plant. In state of Texas, CBD is legalized. You can use it, for your own reason. But medical marijuana is not legalized for everyday use, but it's only by prescription for certain conditions that I will get into. But there's a lot of hype in the media that we are mixing in smoothie, we are doing it after our gym, I use it for my morning coffee. Why is it, suddenly, so popular? I personally feel that it is a business gimmick, but there are three things that it can really work for. And so people are using it, but people also wants to make business. So, stock market is fully about this CBD. A lot of states are legalizing it because they're seeing more offenses having the possession, so they cannot really handle this. So they're saying, okay, use it for recreational reasons, use it for your own reasons. So CBD is the second most used after the marijuana, and CBD is the most the highest component of medical marijuana that is used for in children who have seizures, for people who have cancer and they have a lot of vomitings and nausea because they're not tolerating the treatment. So those are the ones that state of Texas has actually authorized that you can use it, medical marijuana, for certain things, but not anything else. But on the stores, you have the CBD oil, which says that it is pure CBD, but nobody has tested it, but they say that we will give you a certificate. You can use it for pain, you can use it for skin rash, you can use it for problems with sleep. We'll get into a little bit of data. So this is the difference between what a cannabinoid is and the THC is. THC is the most dangerous one, but cannabidiol, yes, in the short term, it can help a little bit. The structure is a little bit different. And people who use THC, they can get psychotic because of the structural difference. As humans, we already have the cannabinoid system in our body. It is a very good system, which helps, especially when we are born from age of 6 to age of 20, our brain goes into a lot of development. It's making several connections for memory, for concentration, everything else. So we already have a system. If we already have a system that equally works, why are we even using it? Because after 20, after 40, sometimes the same receptors are not working. Our brain is aging. And so people have invented, cannabis, saying that, okay, we use this and go and block that cannabinoid system, we might have certain benefits. So I just put a diagram there, but the red one that you see, the flower there, that's the CBD. That does not affect the cannabinoid system. So that's why people are talking that, oh, it is safe to use that one because it's not going to affect the cannabinoid system, which is healthy functioning that our body requires for better immunity, for better memory and all that stuff. So kids need to understand that CBD is completely different from THC. That doesn't mean that I'm not, telling the children to go and experiment with the CBD. Even that, if you have a reason, please talk to the doctor about it before you use it. So any cannabis product with the low CBD content is the highest risk that people can get psychotic. When I say psychotic, I'm standing somewhere and I imagine that Krishna was next to me, he was talking to me. And they get into that sense of euphoria and you do the mistakes, you lose the judgment and you're going and shopping that you don't remember and all that stuff. But cannabis with the high CBD content, can help in little bit of things, but still that is not what I recommend. But just the CBD by itself, there is some data, there is a lot of research now that it can help in the short term between 1 to 3 months, as a medicine to ease anxiety, for sleep, a little bit of, pain and all that stuff. But these are the approved products, in the state of Texas, but it has to be a prescription by a licensed physician, but you're using it for 3-4 conditions, as I said. So this is the most important one. There are some synthetic marijuana that people are selling. That is the most dangerous. I will give you an example. When I was in New Orleans working, a surgeon, he's a physician, he came home and, his kid was in a high school, he was working hard. His dad was always blind that, oh, my son is a bright kid, let him have his own life. One day he came and he asked his son, how are you doing, son? I'm doing good. Okay, I'm sleeping. Okay, I'll go to bed too. Dad has a gun in the house. So he heard few sounds in the middle of the night that somebody was talking to themselves. So he initially thought that somebody was there in the house, an intruder. So he went and tried to open the door of the son. His son is talking to himself. And so he questioned him, son, what's going on? He said, I have a devil in my stomach. He said, what do you mean by you have a devil in your stomach? Oh, I'm fighting with the devil in the stomach. So he asked him, how long you been fighting? He said, I've been fighting for a long time. And he said, I don't believe in all that. Son, why don't you go to bed? And so he went back to his bed. After 1 hour, he had a gunshot wound. So the kid thought like the devil is in the stomach. He wants to kill himself. He wants to kill the devil. So he put the gun to his stomach itself. Short story, the kid survived. But when we explored what really happened, he used synthetic marijuana, which blocks completely the receptors in the brain, none other than the marijuana. So it's more dangerous and people can get completely psychotic. So if you use long-term, so go back to that first screen that all was green, but if you continue to use chronically all the marijuana or CBD all the time, the red ones are the ones that you are going to lose, especially the children until the age of 20. If you keep using it, I see that here 13, 14 years of age, they start using marijuana. The most earliest is 16 years of age. You're losing your concentration, good memory, good judgment. Your brain is losing your ability. That means you are putting your life at risk, from age 17 itself. So I would not really, recommend. The ones in the green are the research that's where it's going on, that they want to, experiment to see if they can treat chronic pain, chronic vomitings, cancer. I'm not saying that it is a cure for cancer, but some of the side effects of the cancer medications. That's what I mean. So this is what, if a kid does not use, CBD or THC, you are having a normal growth, everywhere what, the cells have to be like. But once you start using marijuana, you are causing a cell death. And this is not my research. The research was done in 2016. They've observed around 3,000 kids and they compared how their performance in high school. So it's very important that the kids need to understand that they're affecting their brain, their memory in the short term and also in the long term. So the high school data, that's I was talking about, exactly showed the same thing, that they had poor performance in their, studies, their early dropout rates, early development of mental health disorders. So we have to talk to our kids about, what are the benefits? What are you trying to get? Okay, 3 months of anxiety treatment versus 30 years of your life. That's what you need to think about. So as I said, there is evidence that you can use CBD, not marijuana, or the medical marijuana, which I say, for chronic pain, the cancer-induced nausea, some of the other like sleep issues, something like that. But if you have a family member that already has mental illness like schizophrenia, which is, chronic mental illness, and you use, cannabis or marijuana, you have 20% risk to develop schizophrenia in your life. So that's very, very important for our kids to understand that you should never experiment these drugs. When we don't have research, just because somebody is selling them, don't go and buy them. So the same research I was talking about in 2018, 3,000 kids, they predicted that there was increase in, the psychosis symptoms, which are close to schizophrenia, a year later. So we should not be using this. Yes, in the limited acute improvements in anxiety, a little bit in depression, but there is no long-term outcomes with continued use of marijuana and CBD. We need more research. These are other slides that I don't want, these are some of the American, Society of Addiction Medicine. They're also recommending as of today. From 2012, the research has been going on. Canada is also telling that it does not work for anxiety, it does not work for sleep. Canada has strict rules that even for CBD, they're saying less than 25 years of age, do not use it. And anybody with cardiovascular problems or lung problems should not be using it. I think pregnancy, I think, we have to tell our kids that it's very bad in pregnancy also. In pain, yes, go to the doctor, talk to them, depending on how chronic your pain is, you can get a prescription for that. So the other problem that I have is when you go and get this CBD, we are also not understanding that somebody is making it somewhere. We don't know what compounds are putting in there. We don't know what we are going to get it. I have a lot of patients, they say that I was using the same dealer all the time. All of a sudden I get, these symptoms. That means the dealer has changed the molecule, or he got it from somewhere, that something has been changed. So you cannot really trust these substances that are being, sold, that research has not yet proven yet. So the best things to be healthy again, as our old culture and has taught us, is doing regular exercise, drinking healthy water, enough water. Yoga is the best healing thing for exercise. Our Vedas and 100 years back we were talking about yoga. Now in this country, every app is about yoga. So we need to talk to our kids to have better stress management rather than going for short-term alcohol and drugs. Go for long-term, which can help with better stress management by yoga, exercise. And the main thing, how you identify whose kid is doing what, is one thing that you check their bags, you check their Snapchat. Don't give a lot of freedom. At the same time, don't be too paranoid and don't be too suspicious and keep bothering them. I see some parents every day, they're asking, what are you doing, Dad? What happened today? Which friends did you meet? So we don't need to do that. So, and also, as the officer said, go to the school counselors, ask them in their experience what exactly are the tips that you can identify. So be in close contact with your school, participate in your school activities as a parent, and learn more from other parents on that. So from this, I want, as parents, and if any teenagers that are watching, we don't have any evidence and human studies yet on the CBD and also on marijuana. So my take message is, even though they are approving in all the states, do not use it until we get a little bit more research in the near future. And that's where I end. I know with lack of time, I have to go a little bit faster, but I'm open for questions from here on.
Yeah, Doctor, I got some few of questions from the participants. How do drugs affect the physical and the mental state of their users?
That's a very good question. Initially, when you are experimenting with the drug, you will get mostly the physical changes, nausea, vomiting, those kind of things. Then over a period of 1 year, then you have, without your knowledge, your brain has already made those changes, the negative changes, I mean.
Yeah, this might be the same question someone is asking again. Like, I think officer explained about it. Like, how can we identify if our children are using or becoming involved with the drugs?
Exactly. So if I take example of XYZ, he was active in basketball, he was active in sports, he had friends, he was very jovial with you guys, he was always coming to dinner table to eat, dinner, and all of a sudden you see gradually that he's being more moody, and even after the puberty phase is over, he's only talking to few selected people. Hygiene goes down. They're not paying attention to their hair. They're not talking. They're very short with your hands, with you when you ask some questions. They're sneaking out. The smell, as the dog, the marijuana smell is very typical. Anybody can identify. It's so strong. So those are the signs that you need to look for. And the main important thing is, if he was getting all A grades and there is a big drop, there could be other factors, but this is one of the factors we got to rule out also.
Yeah, thank you, Doctor. Other question is, what psychological issues play the biggest role in causing kids to get involved with the drugs?
Very good question. Mainly untreated ADHD, because the problem is, as parents, we are still not accepting that there is a field like psychiatry. There a lot of us, we don't believe in ADHD. A lot of us don't believe in depression. and we leave it for 3-4 years, and they want to come and they want the doctors to fix all the 3 to 4 years of suffering. So first, we as parents, we need to accept that how we accept diabetes, how we accept brain stroke, there are chemicals in the brain, there are receptors in the brain. If there is chemical imbalance, that can reflect on behaviors, and that is what we call as mental health. So if somebody is not having adequate treatment for ADHD, for example, he's not able to focus, he gets very distracted, he's very restless, then he will obviously look for what is the easiest way of getting my problem fixed. So he will go and look for meth. Somebody with severe anxiety, he doesn't want to go to doctor because social stigma, I don't want to be labeled as mental health. Then he will go and take alcohol, and he will start sneaking because it will relax him. Recently you saw in state of Telangana, just because there was some technical errors in the exam, there were several suicidal deaths. So they were not all sick to begin with, but emotions can play a natural role. So we need to talk to our kids about mental health also. So bottom line, the answer of the question is anxiety, depression, ADHD are the 3 most common things why people abuse drugs.
Thank you, doctor. Does mental health go hand in hand with the drug use?
Yes, it is one of the, for example, you take bipolar illness, 60% of those people abuse drugs. 60%, that's a big number. So majority of the time, a person is using something because he is trying to get rid of a problem. Until unless, that's the question that I ask all my patients when they come to help with drug addiction. What is the reason why you've been using this for? And there is always an answer for that. It could be stress management, it could be his recent divorce, it could be financial stress, it could be that he's not able to focus, he's more anxious, he's having panic attacks, a lot of things.
Go ahead, Anna.
Even at excuse me, even at the workplace, unfortunately, I had the experience of the bipolar disorder. Even though they're not, I know that she, not he, was not using any drugs, and of course she's an Indian lady. But unfortunately, sometimes if you're a colleague, if she has some problem, mental health is a bipolar disorder, then it's if I don't know, it will be very difficult to work with that and identify that they have the problem. So how do you do that?
That's exactly, we need more community awareness programs on mental health to educate people and educate ourselves, so that you look into problems and you tell them to get help. But if you're in an acute crisis situation, somebody is really acting out erratic behavior, you don't know if they're under the influence of drugs or if they're having a flare-up of their chronic problem, always call 911. You are doing more good than doing harm for them. They will be upset with you, but at the end of the day, it will come back to you in a positive way.
Doctor, I would like to ask one extended question to same thing. When the kids, means boys or girls, have this problem, we're talking about the parents, the school administration, the teachers, they play a major role. Don't you think so? Because when a kid goes to school, almost for 6 to 8 hours, he's there in the school with the friends. Many of the people, they gather this habit from there. So probably the more awareness should come from there. Don't you think so?
Yes, that is a very valid point. But what is happening in several school districts is they are having counselors there. So I talked recently at school district. I'm glad that you have a counselor, but the counselor will only help if my kid is having a crisis. I'm more talking about prevention. So a lot of the school districts for the next academic year, there are programs in high school now in Northern Texas that they are talking about, the drugs and the effects and all that stuff. But I think it needs to, there is sex education very early in middle school in one of the school districts. They need to start doing that, around 6th and 7th grade itself, because the kids are already into their puberty around 13, 14. So, that's something that organizations like big organizations like this, and the state psychiatric association and child psychiatrists should go and, request the school districts to have more awareness programs to the kids.
Yeah.
Subbu,
Thank you, doctor.
Subramaniam,
Yeah.
if I may add one more, because you have two daughters and I have two boys, and we all went to high school and came back. It's more of peer pressure for the kids. A lot of pressure, peer pressure, even though they don't like it. But I think at home, we as a parent, I think we need to tell them that, of course, you have to go through that.
I'll tell you one thing, Krishna. What you said is right. Parents will play
a major role.
Needed role. But
Yes.
what happens is the maximum exposure is happening at the school level.
Oh,
because
yeah,
that's
right.
where they have their friends, everything. So probably the kids may not be telling all the information to the parents, number one. And number two is they have a more interaction with the kids. So probably if the teacher and parent interaction is there, then they give more information. See, teachers do give the educational progress about the kid. At the same time, these things also, if they provide, for example, I'll give an example. Let us say one kid has been identified as a drug addict. You, his friends are all the potential targets. So probably you need to keep a more watch on them and see that they don't get into the same trap. That's what I meant to say.
Yeah. Again, if I'm not taking too long, just one more point. As when my boys were kind of in the high school, and we told them that even if you see anything or anything, if somebody come and ask you, the question, I hope I will say this. One of my older boy, they asked him, "How come you don't have a girlfriend?" His classmates used to ask him, I said, "Are you a gay?" He said, "No, I'm not a gay. Listen, I'm here to educate myself. Of course, I have classmates and girlfriend, but doesn't mean that I have to have everything."
So those
You
are
know
the
what I'm
things,
saying?
the peer pressure, and
Yes.
sometimes they don't know how to answer, and we have to also empathize with our kids, because we come to this country, at the age of 30, where we have seen hardships in a different way, and we try to provide them, and they have to adjust to our culture, our norms, and also adjust to the culture here. So it's a difficult thing. So going back to what Mr. Subbu was telling, that we cannot completely put the responsibility on the teachers, but as a parent, how many of gatherings we are having with their friends in our house? Are we having that interaction with their friends? Are we observing when the kids are having their own meetings, what kind of conversations they're having? A lot of us, we don't invite their friends to, our houses. We are trying to send them, to somebody else's house. They're also being picky that they need to make friends with certain ethnic backgrounds. I think, we have that in certain limits. Then it's better that we don't come to these kinds of, countries, because we are trying to, give them that opportunity to learn about every ethnic background, everything, and they need to grow stronger. So I think it's a parent-teacher responsibility. We need to also find out from the teachers on a regular basis, other than academics, are you seeing any behaviors, that should be concerning to you all?
Yeah.
Yep.
Dr. Pavan, as parents, what resources do we have to proactively prevent our kids getting addicted to either alcohol or any drugs? What resources do we have?
So there are, every city has their own chapter of National Alliance of Mental Health, which is called NAMI, National Alliance of Mental Health Institute, or something like that. They're free meetings, you can take to, them, and, ask your kids to, come to these awareness programs. I think the national organizations and the local health organizations, or, the like Tantex, they should take more time to bring, more health awareness, whether it's physical health or mental health, to our kids, rather than, more focus on only culture promotion. That's also important piece, but I think there has to be a balance. And this year, probably COVID helped, current president and current EC team because they don't have the opportunity to go into the auditorium, so they're using Zoom. And so I think, once a year, there has to be a child psychiatrist come on board and talk to the kids about what are the potential. I'm not a child psychiatrist, but I have a little bit of background. So those kind of things will mostly help. And most important question, on the same note, I have so many family members that their kids are completely into a severe disease state. And they don't know what to do. They don't want to call cops, or they have already called the cops, and cops come to the house and they say, he's not a danger to himself. He's not, danger to others. So we are not going to take any action. But every county has a mental health court. If you see that your son or your daughter is decompensating, they're completely addicted to drugs and alcohol, you are requesting them to go and get help. They are not obeying your commands. They are not sleeping in the night. They are doing this. You can always request mental health court judge to sign an affidavit asking to force your beloved family member to go for evaluation with a mental health professional. So that is the opportunity that every parent has if you get into that extreme stage.
Sorry to interrupt y'all, but I have a quick question. You keep mentioning about ADHD, and I know that in the Indian community, ADHD is something that's not talked about. We don't consider it as a thing, but I kind of want to know more about it. I'm just curious. Can you please explain more about what ADHD is?
So I think it's Miss Shruti is who the person talking again, right?
Yeah.
Shruti, if I really want to talk about ADHD, it will take 1 hour. I really had a long day, so I have to wrap it up. But if you want to be very specific, do you have a particular question about ADHD, or if I want? Yeah, otherwise, I will just give a brief description. I think you made a very valid point. Do you have a particular question about ADHD, or you want to have a general idea about what is ADHD?
More like a general idea, because I don't how do I say it? I think my dad is showing symptoms of it, but I just wanted to clarify it because I've heard that there's a lot of different versions of it. So
Sure.
I just wanted to be curious. I'm just curious.
Yes, ADHD is one of the common, brain illness that really responds well to medication because it's completely, related to a brain chemical called dopamine, and it's we need dopamine for reward. When I say reward is, for motivation and everything, concentration. So somebody that is having a chemical imbalance in that area, they will start having problems. The characteristic signs of ADHD would be, and I don't want, you to become a self-doctor, after I explain this. You can ask your dad to go get help. But ADHD is, something that if I give you a book, and a normal person can sit there, if an adult of, 40 years of age, can go for 30, 40 minutes. Somebody can go beyond that. But a person cannot even do for 5 minutes. Then he puts there, he goes and changes TV channel. Then he wants to do something else. And, he's very restless. He cannot focus for more than, mostly it's attentional problems. Then there is another variant called hyperactivity, where they're very impulsive with decision making. They see something, that they want to do, but they don't put much effort and they go and do that in an impulsive way. I see that mostly from childhood. You don't develop ADHD as an adult, but you carry that as from childhood. I've seen in my school and all that, there are some kids very hyperactive. They were very disruptive in the class. But back those days, the punishment that we got was spanking, with a stick. But now I see that those kids, could have benefited from, a little bit of an evaluation because they were the most problematic kids. They were disruptive. They were talking back. They were, not able to sit in the chair for 1 hour of the period. So those are the, signs of the ADHD, and they beautifully respond to the treatment. If you don't treat ADHD, then pretty much you will have so much problems, across the life, including college, job performance, marital performance, and everything.
Oh, okay. Because the one thing I noticed with my dad is whenever he wants to do something, if he puts his mind into it, he does it. Or if it's something that he doesn't want to do, he tries different situations, like going out and playing tennis a lot, listening to music a lot instead of doing that work. So that's why I was just curious about it.
Yeah, so based on what your observation, I cannot really comment anything, but people with ADHD, they can be hyper focused on things that can stimulate their mind. So that could be video games, especially we see in the kids. But there is a lot of a question about, oh, my child has no problems with focus because he can sit there for 30 minutes or 30 hours, and if I don't stop it, he can keep playing it until midnight. Yes, because they're hyper focused on one thing, and that can be also a variant of ADHD.
Yeah, that's what I was really confused. Like, as you mentioned, there's many different versions of it, and I was just
so politely ask your dad if everybody in the family is being affected with his behavior. I think it doesn't hurt for him to get an evaluation.
okay. Then thank you so much for your advice.
Thank you.
Can I ask a question about recovering from addiction?
It's very hard and depends. If you kill the weed early before it becomes a bush, yes.
No, I understand. So I'm speaking from experience. I know parents can warn the kids and raise the kids well, but sometimes it doesn't matter. The children face peer pressure, and in colleges especially, the drinking is so prevalent. Everybody drinks. I mean, most, not everybody, but I know some kids who drink the same amount do not get addicted. Some kids do, and it's based on their genetic makeup. And once they get addicted, I know there is a lot of stigma, especially in our community. And can you talk about what role the recovery and also the organizations like AA or Al-Anon plays, and how to overcome the stigma in our families?
So, as I said, when I say that the treatment is difficult, what I meant was it is a combined approach. There needs to be support from the family, there needs to be support from community, there needs to be motivation from the person.
Mm-hmm.
If it has been a chronic problem, yes, it takes multiple steps. Long-term rehabilitation is what I find more successful, where you're going for 3 to 6 months in a controlled environment.
Correct.
Where you're identifying what exactly first triggered. Okay, it's all about peer pressure. I don't think so. It could start from there, but
Yes.
they need to also, put their pen down on the paper and look at it. Okay, it started with peer pressure, but is there something else I'm missing? So if a client can really show that motivation, that these are the problems that I was using this for, and I developed addiction, then you try to, treat those problems, whether it is mental health or whether it could be, something, psychosocial, like more stress induced. But AA meetings can also help, but I would recommend that if somebody has a chronic, like a 12-month addiction, and they're not able to control, I would recommend long-term rehabilitation, somewhere 3 to 6 months. And then after they come back, then they maintain the progress by attending the AA meetings and, learning about it and, trying to prevent the relapse happening again.
Correct. But in my experience, I have found, because I go to some groups, therapy groups also, and I learn about so many cases. It is not at all about willpower to stop it. Once you have the genetic makeup, people, it's very easy to get into that loop. So that's what people also need to understand and get educated. They think it's somewhere that a person who is addicted has some moral lapses or did something wrong. They could not control themselves, but it's not about that.
Yes, you are correct. I think you have gone to those groups and you have seen, people having multiple relapses and they're coming back and they're trying to recover. Yes, there will be, hiccups, in the path of the journey, because addiction is the most difficult thing to treat compared to ADHD or anxiety or depression. But if there is a collaborative approach, I have seen positive results, if you go in certain direction. But yes, every human brain is different, and their genetic makeup is different. But unfortunately, the ease of availability of the drugs in this country makes you more vulnerable to be addicted.
Yes, I agree. Thank you.
Doctor, other question I think maybe related to the Priya Kodali asked. Since there is a big stigma surrounding rehabilitation and therapy, how can we destigmatize these ideas?
So why do you want to compare to others? Yes, when I go into the public, people make fun of me. Sometimes they say, "Oh, doctor, how many people did you see today?" But end of the day, I tell they are not crazy people. It's a brain illness. So you first accept that. Forget about what other people are looking at you as. You're not answerable to them. You don't need to tell with a blackboard on your chest and say that I have a family member with mental illness, I'm going out for therapy. You don't need to tell that. You maintain your privacy. You reach out to the resources, call your insurance, ask, we need a counselor. Who is there in the panel? Then you call the counselor and you tell the counselor, whether it's a Caucasian counselor or African American counselor or Asian counselor, tell them that I'm seeing things like this in my kid. He's willing to come, or he or she is willing to come. Take them to the counselor. If the counselor says this is beyond my scope, he needs a combined approach like medication and therapy, then you take the combined approach. But you sit at the home and saying that we never had in our family, none of our family members in India went to a psychiatrist or counseling. You are first creating stigma in your own door, and you're not letting it go out. Forget about what others in the community will think about. I hope I answered the question.
Thank you, doctor. So other question is, does drug use have long-term effects on their users, and what are they?
Long-term effect on what?
Does drug use have long-term effects on the users, and what are they?
On the users or what?
Yeah, I mean, who are they using it?
Oh, okay. Yes, it has, based on the presentation I said, depends on the product that you are using. If you're using alcohol, pretty much you can, count any kind, you're putting your body at risk for cancer. But I'm not saying that everybody that drinks moderate amounts, like 1 to 3 drinks, as I said, per week or, that. But if anybody that is abusing or addicted to alcohol, yes, cancer is the one, brain, early dementia, which is memory problems, eye problems, skin cancer is more prone. But the other drugs like the marijuana, the methamphetamines and cocaine and all that, they are more, to the brain in the long term. The cannabis is the silent poison killer. You don't see the effects initially. You feel a lot better. That's why a lot of kids use it. I recently had one, kid who said, I started 3 years back. I said, for what? He said, it made me feel good. Okay. Why are you in my office if it's still making you feel good? He said, it's no longer making me feel good. Okay, so you're coming back after 3 years and telling it's not making you feel good. So the marijuana is the silent, brain killer, where it affects your, performance in school, the amount of knowledge that you can retain, and you can reproduce. So that becomes a memory problem again. And their academic scores will go down. And if you keep using it, there is a chance that you can develop a little bit more serious mental health issues.
Okay. If a kid has ADHD, how to overcome in a natural way, and how long it would take to normalize?
So I'm not going to downplay that there are no natural ways to treat ADHD, but it all depends on if somebody has a severe form of ADHD, the natural ways of treating the illness cannot be possible. You have to have medication. If somebody has mild to moderate, the old ways of pranayama, alternate nostril breathing, is a very good source to increase focus. Meditation is one of the best thing that I tell, most of the kids that start getting into that practice right now. Mindfulness-based meditation, there are a lot of apps. Doing it like 3 to 4 days a week for 15-20 minutes really can help. A lot of the kids who are very hyper, that means they are giving you a warning that they have tons of energy, so they need to burn that energy. So exercise is one other thing. So your diet should not have too much of carbs and sugars. That's the other thing that makes them more hyper. So sodas like, Coca-Cola, Pepsi, whatever those have caffeine products should not be given. So if you do a little bit of diet modification, pranayama, alternate nostril breathing with diet, I think you can have a little bit success, 30 to 40%. But if it is too severe, then you have to have a combined approach.
Yeah, thank you, doctor. So other question is, what would be the best way to handle the situation if a parent finds out their kid is the victim?
Victim of drug use?
Yeah.
Yeah, you need to, have a conversation with how long it's going on. Don't intimidate them. Don't get upset initially. I know you'll have a lot of emotions, but you got to have an open forum discussion with mom and dad. Don't involve anybody else. We have the habit of calling brother's wife, and everybody comes, and it's a big thing. Don't do that, because they will be very intimidated by that. So as parents, it's your responsibility to open up, to find out why, what is it helping him, how long it's been going on, what are his future goals about this, how is it affecting him in a positive way and negative way. And if he tells that it is affecting him more negative, then you say that, okay, you realize that it's more negative than positive, so why don't we go get help. That's how I will approach my kids.
Yeah, thank you, doctor. Can you compare vaping with the ones you talked about, like CVS, marijuana, etc.? Which one is more dangerous, CVS, CBD?
CBD versus what?
CVS versus CBD.
There is no CVS, but vaping is a general term. You can vape CBD, you can vape marijuana, you can vape nicotine. They're all three different things. I would not recommend anything. So especially marijuana, a lot of people try to vape marijuana because it goes into your lungs faster and you get the benefits, faster, like feeling high or, reducing your anxiety. If you take a CBD by gummy or brownie or a pill, it takes 2 to 6 hours. So always they try to inhale because it's a faster way of getting the benefit out of it.
Yeah. So other question is, what causes teenagers or adults to seek or depend on drugs?
Yeah, as I mentioned, there are a lot of genetic factor. One of the member also mentioned peer pressure, how we all raise kids, not having that good rapport, being too strict, at the same time being too lenient with their activities, not having any kind of supervision. Family history is one component. Little bit of trauma also is one thing, because they're not able to cope well. If there was major accident or they lost a family member very early in life, there was an abuse, physical, for extended periods. Those are the common things that I see that they get into drugs. And easy availability is the most foremost thing. That ads, advertisements, like the officer said, personalities and, higher ups, talking about it. They're saying, I'm doing it and sitting in California doing nothing. It might not be doing nothing to him, but I'm not him. All 5 fingers are not standing at the same height.
Okay, yeah. So what is the likelihood that a teenager who gets involved with the drugs will carry the habit into adulthood?
It depends on the substance. If it's nicotine, like cigarettes, there is a very high chance. Alcohol, very high chance. Marijuana, very high chance. The other 3, I don't see in our genetic component that I see those drugs very fun. So, but the chances are 50% or more.
Okay, doctor, thank you. How does using drugs affect professional and personal relationships?
Well, if I come drunk home every day, I'm fighting with my wife every day. So the family disharmony, violence, accidents, your performance at job, because you're not waking up, on time, you're not able to focus, and your, performance at job is going down. If it's kids, their grades are going down, and, they can also be arrested for intoxication. And as they said, depending on the charge, if it's a felony, because federal laws are different. Federal law doesn't even recognize CBD for legal use. Individual state laws are different. So kids need to make themselves aware of this, that at federal lines, anything that you get, once you get a federal offense, you're losing your beautiful opportunity to get into best colleges or, whatever jobs that you want to do and all that stuff.
Thank you, Doctor. Other question is, has there been a spike in drug use during the COVID pandemic?
If it is related to our community, I would say, less. If it is outside of the community, yes.
Okay, Doctor. Yeah, if anyone has questions,
కృష్ణ
yeah, free to
పవన్
ask.
ఒక ప్రశ్న ఇది థ్యాంక్ యూ సో మచ్ ఇట్స్ బీన్ వండర్ఫుల్ సెషన్ ఇట్స్ వెరీ వాల్యుబుల్ సెషన్ డాక్టర్ పవన్ అండ్ థ్యాంక్ యూ కృష్ణ ఫర్ హోస్టింగ్ నా ప్రశ్న ఏమిటంటే మనం పెరుగుతున్నప్పుడు ముఖ్యంగా భారతదేశంలో ఒక 20-30 ఇయర్స్ బ్యాక్ ఇప్పుడు కూడా బహుశా అలా ఉందని తెలియదు ఎవరికైనా మెంటల్ ఇల్నెస్ అనేది ముఖ్యంగా మనకు అవగాహన రాహిత్యమని చెప్పుకోవాలి బాగాలేనప్పుడు దయ్యం పట్టిందని వాళ్ళని కొట్టడము లేకపోతే యాపమండలతో ట్రీట్ చేయడము రకరకాలుగా ఉండేది తర్వాత అది చూసినప్పుడు ఎవరికైనా మెంటల్ ఇల్నెస్ వచ్చిందనుకోండి ఓహో ఆయన పిచ్చాసుపత్రికి పంపించారంట మనకి ఈ మూవీస్ లో కూడా బిలిటిలింగ్ మెంటల్ ఇల్నెస్ పేషెంట్స్ జరుగుతూ వస్తుంది అనమాట దానివల్ల ఇందాక మహిళ చెప్పినప్పుడు స్టిగ్మా అని దట్స్ హౌ వీ వర్ రైజ్డ్ వీ హ్యావ్ గ్రోన్ అప్ సో దానివల్ల ఏంటంటే ఇప్పటికి కూడా ఇక్కడ కూడా చాలా మంది మన ఎన్ఆర్ఐస్ లో దే స్టిల్ డు నాట్ హ్యావ్ ఎ గుడ్ అండర్స్టాండింగ్ ఆఫ్ మెంటల్ హెల్నెస్ ఇది మెంటల్ హెల్నెస్ అలవదు మెంటల్ హెల్నెస్ కాకపోతే ఒకే పిచ్చి పట్టింది లేకపోతే ఇంకేదో అబ్యూస్ ఈ అబ్యూస్ కూడా మనం చూస్తున్నాం టీవీస్ లో ఐ థింక్ దేర్ ఇస్ అ లాట్ మోర్ ఎడ్యుకేషన్ దట్ అవర్ కమ్యూనిటీ నీడ్స్ ఆన్ మెంటల్ ఇల్నెస్ ఏది మెంటల్ ఇల్నెస్ లేకపోతే ఈ పీర్ ప్రెషరు ఐ మీన్ ఇట్ బేసిక్లీ బాయిల్స్ డౌన్ ఎవరికైనా బాగాలేకపోయినా కానీ 10 మందితో తనకు పిచ్చెక్కిందంటే తను హాస్పిటల్ పెట్టారంట ఈ టైప్ కాన్వర్జేషన్స్ ఉంటాయి మన కమ్యూనిటీలో ఈ రోజు కూడా even though we are living in an advanced society like US, we lack a lot of knowledge.
Yes, I agree, Anna. We all need to stop using the word that crazy and pitchy and all that.
Yeah.
As I explained in some of the slides, every disease has a valid, reasonable explanation that has been scientifically proven by doing MRI scans and research. So yes, in olden days, even when I was not in medical school, I was not aware of it. And that's why I particularly took interest that, this is something that, we have to learn and we have to give it and share. And I think, recently I've seen a spike in our community. They are reaching out, they are asking for help. So we are able to save some lives.
Thank you.
Dr. Pavan, a quick question on the alcohol, especially red wine. There has been some news that using red wine is actually healthy or healthier. So the question is, using, let's say, even one glass of red wine is better, or no use of alcohol is better?
So based on the American Heart Association, their guidelines, you have to keep in mind diabetes and all that stuff. I'm not a medical doctor, so I'm not going to, don't count me on this, but as far as I know, your question is one drink of one standard drink of wine with 14 grams of alcohol, I think, is just fine. I don't know if long-term benefits are there, but there is no, acute, or long-term, problems by doing one glass of wine a day. But you have to keep in, if you are diabetic, wine is not a good source because it's high content for sugar.
Thanks, Doctor.
Dr. Pavan.
Subhash Garu, I think you raised the hand. Can you please ask the question if you have any?
Yeah. Dr. Pavan Garu, thank you so much for the talk. మీరు అన్నట్టుగా ఈ రోజుల్లో అంటే నార్త్ అమెరికాలో బాగా అవైలబిలిటీ చాలా ఈజీగా ఉంది. ఇఫ్ ద కిడ్స్ వాంటెడ్ టు గెట్ సంథింగ్, ఇట్స్ వెరీ ఈజీ టు గెట్. లైక్ మనకు ఓల్డెన్ డేస్ లో ఉన్నంత ట్రబుల్ లేదు. అయితే కొంచెం రివర్స్ గా వెళ్ళి మనం అంటే లైక్ పీపుల్ వాంటెడ్ టు, లైక్ కిడ్స్ వాంటెడ్ టు డ్రింక్ సంథింగ్, కెన్ వి ఆస్క్ దెమ్ టు డ్రింక్ at home, like in our presence, something like that?
That's a personal choice. Why not? If you have, that accommodation, but most of the kids, they don't want to be, drinking with, parents. That's what I see. I don't know the reason why, because they want to connect. They always see that, we are raised with a different culture. Our ideas are different. Some kids are, comfortable in doing it, but you need to have that conversation very early in their lives, and say, it's okay. I'm willing to join you all, for your first drink. Please call me if you're somewhere and you don't feel comfortable to drive. I'm there to help you, or I'll book an Uber for you. You got to have that, rapport built with your kids. Otherwise you cannot overcome this problem.
Yeah, that way, like my kids might feel a little bit more comfortable, like talking more about it at home, or like if they like all they want is the first thing is an experience, right? Like
Yes,
they might be more excited about it, and they go outside and drink or whatever. The outside drinking could be under control. It's out of control, but if they drink with the family, it should be like very much control, and it could be like more helpful than drinking outside. I'm just giving a thought, like does that could help kids?
yes, it does.
Okay, thanks.
Yeah, if anyone have any open questions, please feel free to ask the doctor. Otherwise, we will wrap up.
డాక్టర్ గారు, పవన్ గారు, మీరు చాలా చక్కగా, అంటే మామూలుగా జ్వరం వస్తే డాక్టర్కి వెళ్తే మెడిసిన్, ఇది చాలా మందికి ఇండియాలో తెలుసు, ఇక్కడ తెలుసు. కానీ ఇందాక చాలా మంది చెప్పినట్లు దిస్ ఈస్ ఏ టోటలీ డిఫరెంట్ సైన్స్. ప్రాబబ్లీ ఇట్స్ మైండ్, అంటే మన యొక్క ఆలోచన మీద ఉంటుంది అది. సో పీపుల్ నీడ్ టు మీన్స్ what you said is right, that collaborative approach between the kids and parents very, very important. Obviously that goes a long way. Probably back in India it was like a totally different, it's a peer pressure, could be from your own
back in India you had a different support system.
Exactly. So here
neighbors come in every often. The time we had was different. We didn't know what drugs were available. We didn't see any marijuana signs. There was bong, but the people used to do it only when they go to northern India. But even in India, drugs are coming now. But here we are all at one part of family as four. At least Dallas is better. It's a bigger community, so we need to utilize the resources, take them to the cultural events. Have a little bit of distraction from their regular activities. Going with them a little bit for movies. Having a short trip. Depending on your budget. Talking to them about what is happening in their personal life, paying attention to their grades and all that stuff. I think if you do that and have a friendly talk about, what is out there, what is, I heard from a psychiatrist that he presented this beautiful presentation that you should not think about it, but if you really want to, I think we need to have the discussion ahead of time. I think those kind of conversations can help people to make a better decision.
Dr. Gara, one request, ante when some organization arranges this kind of thing, awareness happens. Probably since you are so knowledgeable, so experience, probably what you should do is maybe social media. I don't know, you are very busy. Maybe you need to allocate maybe 1 hour a month or 1 hour a week. Have a more interaction on the social media so that people can approach you. When you talk to the people here in this, they're asking so many those.
Yes,
it could be a simple answer from your side, but it gives a tremendous amount of confidence to those people. Maybe you need to interact more, and why don't you impart that more awareness? Maybe schools here. I think that's one request I would like to make to you. We've seen a lot of your talks earlier, also very informative. You should do that. I think
we are also going to have a. Tantex is also looking into having a central hotline number for any acute crisis situations like
excellent that. Yeah, that would be
and based
nice
on
actually.
The priority of the calls and the nature of the calls, we can certainly make a panel of physicians and one or more counselors. I will try to reach out in the community if they can participate, and we'll also bring some counselors to talk more about what they have seen in the kids, what are the major problems, and I think we can do that in the future months.
Yeah,
that's a nice point, Dr. Garu. This is Jagan from Detroit. ఇప్పుడు మీరు చెప్పింది జస్ట్ మీ టెక్సాస్ వరకే కాకుండా ఎంటైర్ యుఎస్ కి ఎక్స్పాండ్ చేస్తే బాగుంటుంది. అంటే డెట్రాయిట్ చూసారనుకోండి, ఇలాంటి సెషన్ ఇప్పటి వరకు జరగలేదు ఇప్పుడు. సో
దట్స్ ఎగ్జాక్ట్లీ చెప్తున్నానండి. ఆ సోషల్ మీడియా ఇందాక చెప్పింది అదే అనమాట. అందు గురించి రీచ్ పెరుగుతుంది ఆ రకంగా.
That's a very valid point. It's just the matter of time, especially after the COVID, things have gotten, a little bit, worse for the physicians today. Yesterday, 28th itself, I'm going to say this and I have to wrap it up. There were 80 admissions to one hospital. They're pretty much full of COVID patients. So please take this very serious, wear your mask. There are no ICU beds in one of the hospitals that I work. They're stopping all the cardiac procedures because they want to keep the COVID. If a person has COVID, it can also affect the brain. There was recently in New Jersey, a patient was given steroids to treat his lungs. He developed a brain problem, and family members, were very panicked, don't know what to do. And one of the local organizations from there called me, and we were able to help the patient. But steroids can also affect the brain. So don't panic about if you see those things. COVID also is contributing to psychiatric problems. If you have any of those questions, always reach out to Krishna Reddy Garu and leave the question, and I will be able to send a reply to that, or go to the emergency room depending on the severity. Thank you, Krishna. I have to leave, and thanks for the opportunity.
Thank you, Doctor. Thank you very much for your time, and also thank you to Officer Dr. Kayla Karne. You both made very good session today, very interactive, and also very informative. I think it helped to the community. Thank you once again from the Telugu Association of North Texas. Stay safe, everyone. Thank you, Doctor.
Thank you.
Thank you, Pavan.
Take
care.
Thank you, Doctor, and thank you, Krishna Reddy, for the program.
Our pleasure, Anna. Thanks, you.
Krishna.
Thanks for joining. Thank you.
Good job.
Thank you. Thank you, Anna.
Krishna, this is probably the most popular show for the year.
Thank you, Anna.
You are ending the year on a good note.
You didn't really leave any space there until July. I mean, this is December 30th.
Thank you, Paleti Garu. All the best, and all the best next year.
We'll continue, Andy. We'll continue the sessions.
Yeah,
Krishna,
do we have tomorrow
Keep
also
up the good
something?
work.
Krishna, do we have something tomorrow?
Let you know.
We'll do it. We can do it.
Krishna, super mirror.
January 3rd నుంచి కొత్త సెషన్ ప్రారంభం అవుతాయి అన్నమాట. Very good. Congratulations, everyone.
Thank you.
Wish you all the best, the Tantex, incoming Tantex Executive Committee. God bless you, all of you.
Thank you.
Thank you all. Thank you.
Thank you.
Take care.
Stay safe, yeah. Bye.
Bye.
Happy holidays. Thank you. Bye.
Happy
Happy New Year.
holidays.
Thank you.